And then I was like, I just want to know how bad was it in COVID for different populations. And if you look at Indigenous Americans and African Americans and whites and, however you want to classify these different groups, it was a lot safer being white during COVID than it was being black during COVID or Indigenous American. I mean, if you were Indigenous American and you went to the hospital, you were in deep, deep doo-doo. And I don't know if it was because of
Why?
the care they had access
Why?
to. Yeah, that's a good question, but the data does not lie. The deaths per 100,000 in these different populations were drastically different, drastically different.
Jeez,
And
that's bad.
so if you look at, and we can link, we can put a link in the show notes of this data too. And it's number one, the insurance that they had access to and what was covered for the procedures. There's decision
Mm,
making had to be made. Number two, the healthcare that they had access to in the community hospitals versus the urban hospitals